Can you tell me about the Future Crisis Center?
Absolutely. That is one of the number one projects that we have going on. And this is due in part, I believe, because of our strong partnerships and collaborations, but mostly with the support of our Board of County Supervisors, not only for the policy and their advocacy and recognizing the importance and the need in our community, but putting some local funding to initiate this crisis receiving center. And we are awarded the operational contract to Connections Health Solutions last November, and they have been working with us ever since on the design because it is a very specific design based on the Crisis Now model. Our staff and their staff have been working together to really develop it from the point of the person being served. It will have 16 They will have an urgent care where individuals can walk in if they're experiencing a behavioral health crisis, or if they need to be brought in either under an emergency custody order or a temporary detention order. We will have 16 beds for adults if they need to stay, or 16 23-hour units, recliners, which will allow them to be assessed and interventions started immediately. And we have partial funding from the state for the youth portion. So we serve adults and youth in a separate unit. But the youth in our planning at full capacity would be 8 beds and 8 recliners. However, as we're moving along in this process, and since this is very new to the state, and working with Connections, what we're finding is that 16 and 16 are actually more cost effective than 8 and 8. So if we get additional funding to complete the youth, and we're hoping to from the state, it will have 16 beds and 16 23-hour recliners itself. And it really is very new to the area, because we're also looking at putting some of our community services programs, co-locating them in the Worth Avenue building, which is the site that the county purchased for this site. And we've already established a lot of community partners around this with respect to funding. For example, Potomac Health Foundation has given us $2 million to support our build out. Some of the programs that we will have around the CRC will be our trauma program, our same-day access, our youth program. We will have a homeless housing assistance provided. We're looking to have a pharmacy there. We are specifically putting programs that would help either those coming out of the crisis receiving center connect to community services that they may need, or possibly prevent that from happening if they can get services and get connected to services. So we're really hoping that this will be a partnership that addresses some of the needs and gaps we experience in the community.